I was told I needed a knee replacement. I didn't want the painful surgery. They don't. I was looking for something to soothe the pain, then I found this place. I went in limping and in pain, and 15 minutes later, I walked out without pain. 8 months later, I still don't limp or have any pain. The staff is wonderful. I explained to them, you know, I've done this for the last 7 years. I've spoke to over 3,800 doctors. Over that time, I found out what keeps people up at night. And by the way, this discovery call takes 20 minutes, maybe 30, if we're moving towards a purchase. But they're all moving towards a purchase. They're all going to buy at some point. But I really hit them. After I've connected on some levels and, you know, oh, you went to school at this place. Oh, yeah, you know that guy. Then I say, hey, Bill, Dr. Bill, what's keeping you up at night? What are your pain points? What are your sticking points? And they start opening up to me. And they start telling me. And you know why? Because I have the solution. We have the solution. We have something that can help their patients avoid drugs and surgery and cortisone and joint replacements, help them heal faster, get their patients well, but also make their clinics financially stable. And they like that. And they tell others. So how long will they be able to keep doing the work they do? After building this trust, you know, I do that. I say that to them. And how will they grow? I said, well, what's your plan to change that? Right? Because I say this to my patients too. Do you want to go home, or do you want to get better? Well, I want to get better. Well, because if going home and not signing up for my care plan, you're going home to do the same thing you've done over and over. And what is that? That's the definition of insanity, right? Doing the same thing over and over and hoping for a different outcome. So I let them know right there before they're leaving. I'm like, I want a commitment before you leave, because you walk out that door, you're no longer my patient. So I want to know. And I teach these doctors how to do this. So the way you grow a practice is you invest in marketing, you invest in people, you invest in coaching, you invest in technology. This is not an expense. Like, an expense is if you go buy your wife a new Lexus at Christmas and they put the big red bow. Has anybody ever done that? And you pull it out in front, like, what a cool dude this guy. I'm not doing that. But and then the wife comes out and, oh, thank you. That car just depreciated 15% when they pull off that lot. Guess what our device does? It's an appreciating asset. That's what I say. It just only makes, it's a golden goose.